What is degenerative disc disease? Degenerative disc disease is when normal changes that take place in the discs of your spine cause pain. Despite its name, this condition isn't actually a disease. Degenerative disc is a condition caused over time by injuries, sports, daily activities, or if a spinal disc dries out and shrinks. What are spinal discs? Spinal discs are like shock absorbers between the vertebrae, or bones, of your spine. They help your back stay flexible so you can bend and twist. As you get older, they can show signs of wear and tear. They begin to break down and may not work as well. Nearly everyone's discs break down over time, but not everyone feels pain. If worn-out spinal discs are the reason you're hurting, you have degenerative disc disease. Types of degenerative disc disease. Disc degeneration typically develops in the parts of your spine that move the most, your lower back or your neck. Lumbar degenerative disc disease. Your lower back, or lumbar spine, has 5 vertebrae, which are the largest bones in your back. Doctors refer to them as L1 to L5. Spinal discs separate each of these vertebrae. About 90% of disc problems caused by degenerative disc disease happen in the lowest portions of your lumbar spine. Cervical degenerative disc disease. This happens in your neck, or cervical spine. 7 vertebrae make up your cervical spine. They are each separated by a spinal disc. Your cervical spine supports all sorts of movements, such as turning your head from side to side and looking up and down. Disc degeneration in this area can make those movements painful and difficult, though many people have no symptoms. Degenerative disc disease can result from sports, injuries, daily activities, or aging. Degenerative disc disease causes. Your spinal discs are made up of a soft inner core and a tough outer wall. The discs change in ways that may cause degenerative disc disease, such as by drying out. When you're born, the discs in your spine are mostly made up of water. As you age, they lose water and get thinner. Flatter discs can't absorb shocks as well. The water loss also means less cushion or padding between your vertebrae. This can lead to other problems in your spine that may cause pain. Cracking. Stress and strain on your back can cause tiny tears in the outer wall of your discs, which contain nerves. Any tears near the nerves can become painful, and if the wall breaks down, the disc's soft core may push through the cracks. The disc may bulge, or it may slip out of place, which is called a slipped or herniated disc. It can affect nearby nerves. Such tears can be caused by daily activities. Wear and tear on your back from the things you do every day, like lifting a heavy laundry basket, picking up a crying child, and working in the garden, can contribute to disc degeneration over time. Injuries. Even minor injuries to your back, from a fall, for example, or lifting something heavy incorrectly, make disc degeneration more likely. You may not feel pain at the time of the injury, but their impacts add up over time. Degenerative disc disease risk factors. A number of things boost your risk of disc degeneration. Some of them can be avoided, while others can't be. Aging. This is the big one. As you get older, your discs begin to degenerate. Some experts estimate that about 9 out of 10 people will show signs of disc degeneration by age 60. But that's considered normal, and it does not always cause pain or other symptoms. If you do have symptoms, you likely have degenerative disc disease. Obesity. Several studies have linked being overweight to spinal damage, including degenerative disc disease. Excess weight puts stress on all parts of your spine. If you have obesity and carry the bulk of your weight in your middle, your risk of degenerative disc disease may be particularly high. Heavy lifting and manual labor. Some research suggests that jobs in which you have to do a lot of heavy lifting may modestly bump up your risk of disc degeneration. Family history. Did one or both of your parents have degenerative disc disease? If so, you may be at higher risk because it can run in families. Scientists have identified many genes that may increase your risk. Smoking. Need another reason to quit? Several studies have reported that smoking ups your odds of degenerative disc disease. But that's not all. If you already have degenerative disc disease, smoking may make it worse. You may feel more pain. If you need surgery, smoking may make you more likely to have complications. Degenerative disc disease symptoms. You'll probably feel a sharp or constant pain in your back and neck. Your exact symptoms will depend on where the weak disc is and other changes it has caused. Common signs include pain that feels worse when you sit and better when you move and walk. Feels worse when you bend, lift, or twist. Gets better when you change positions or lie down. In some cases, degenerative disc disease can lead to numbness and tingling in your arms and legs. It can also cause your leg muscles to become weak. This means the damaged discs may be affecting the nerves near your spine. The pain, which can be severe, may not be constant. This is because the bone around the injured disc has become unstable. This instability can cause pain that lingers as briefly as a few days or sticks around as long as a few months. The pain that you feel may range from mild to disabling. The pain starts in the area of your spine where the disc degeneration happens. Lumbar disc degeneration leads to pain in your lower back, while cervical disc degeneration causes pain in the neck. But that pain and discomfort is not always limited to those areas. A degenerated disc can pinch or compress the nerves in your spine. If that happens, pain can travel to other parts of your body. A pinched nerve in your lower back can cause pain in your buttocks and thighs, while a pinched nerve in your neck may cause pain in your arms and hands. Degenerative disc disease diagnosis. Your doctor will talk to you about your medical history and your symptoms. They may ask you when the pain started, which part of your spine hurts, if it has spread to other parts of your body, if you've had past spine injuries, if you have a family history of similar problems. They'll look at your spine for signs of the condition, like pain in your lower back or neck. They may also ask you to walk or bend to see which movements cause pain. Your doctor may order an X-ray or MRI to check for bone or nerve damage near your spine. Degenerative disc disease treatment. The goal is to ease pain and stop more damage. Your doctor will suggest the best plan for you, based on your symptoms and how serious your condition is. Treatment may include medication. Over-the-counter pain relievers like aspirin and ibuprofen can help fight inflammation. They can ease your pain and lessen swelling. Your doctor may prescribe a stronger drug for pain if you need it. Degenerative disc disease may also lead to muscle spasms. Your doctor may suggest medicine to help relieve them. Physical therapy. Specific movements make the muscles in your neck and back stronger and more flexible. This supports the spine. In most cases, physical therapy and pain medication are enough for long-term relief. Steroid shots. These have strong medications to ease pain, swelling, and inflammation. Your doctor may suggest you get a shot in the epidural space in your back, a fluid-filled area around the spinal cord, or get one in your nerve or muscle. Radiofrequency neurotomy. In this procedure, your doctor will use radio waves to heat and destroy nerve tissues in your spine. This prevents the nerve from sending pain signals to your brain. You may feel immediate pain relief, though it could take up to 3 weeks for the benefits to fully kick in. That pain relief typically lasts 6 months to a year, though it can continue for several years. Unfortunately, some people do not benefit as much as others from this procedure. Dealing with degenerative disc disease pain. Medical treatments are not the only way to manage your pain. Here are some other things that you should try. Slim down. Excess weight strains your back and raises your odds of nerve damage and pain. Losing weight can help prevent or ease your discomfort. Get a massage. Some research suggests that massages can offer temporary lower back pain relief. Massage may be included in your physical therapy plan. Try TENS. Transcutaneous electrical nerve stimulation, or TENS, is a treatment that delivers small electrical impulses to your body to help ease pain. The treatment shouldn't feel painful, but more like a tingling sensation. You can buy a TENS device over the counter and use it at home. Ask your doctor to help you pick out the right TENS device for you and to show you how to use it. Correct your posture. By sitting and standing with a proper posture, you keep your spine in alignment and ease its workload. That can help prevent back pain. Your physical therapist may give you exercises to improve your posture. Exercise regularly. Lots of different types of exercise can help ease your back pain. These include yoga, tai chi, Pilates, and stretching. Talk to your doctor before you begin a new exercise program. Try hot and cold therapy. Apply a heating pad for 10 to 15 minutes to your back, then swap it out for a cold pack for another 10 to 15 minutes. Do this 3 to 4 times daily to ease pain and inflammation. Degenerative disc disease surgery. If other treatments don't work, your doctor may recommend surgery. There are several options to consider, including spinal fusion. In this procedure, the damaged disc is removed and replaced by bone that connects to the bones above and below where the disc used to be. This eases pain and helps your back work better. Discectomy. Part of the degenerated disc is removed. This relieves pressure on the nerves, easing pain, numbness, and weakness. Foraminotomy, laminotomy, and laminectomy. During these procedures, the surgeon removes a portion of bone in your back in order to reach the problem disc and cut out the damaged portion to relieve pressure on the nerves. You may undergo a combination of these procedures. Artificial disc replacement. Your surgeon will remove the disc that's causing your pain and replace it with a disc made of metal or metal and plastic. Things to avoid with degenerative disc disease. You can help your back by avoiding the following. Smoking. As mentioned earlier, smoking can worsen your pain. It also can make treatment for degenerative disc disease less effective. Heavy lifting. Lifting heavy weights puts strains and stresses the discs in your back, especially when done frequently, such as for work. Overdoing it with alcohol. Excessive drinking raises your risk of back pain. Sitting for long periods. Your back will feel better when walking rather than spending too much time at your desk or on your couch. High-impact exercise. Exercises and sports that involve running, jumping, twisting, and other high-impact movements, think football, weightlifting, tennis, can be hard on your back. Try low-impact exercises like walking and swimming instead. Degenerative disc disease prevention. While you can't stop getting older, the #1 risk factor for degenerative disc disease, you can make some changes that may help prevent or slow the damage to your spinal discs. Maintain a healthy weight. Quit smoking or don't start. Get regular exercise to keep your back strong and flexible. But always talk to your doctor before beginning a new exercise program. Takeaways. Degenerative disc disease is a condition where your spinal discs break down with age and daily activity. Regular, low-impact exercise like swimming or yoga can help prevent the onset or slow the progression of the condition. While there are many non-surgical and at-home treatments you can take to manage your pain, surgery may be necessary for long-term relief. Talk with your doctor to figure out the best treatment plan for you. Degenerative disc disease FAQs. How serious is degenerative disc disease? Discs degenerate as you age. It's a natural part of getting older, and you may not develop symptoms. But the degeneration can cause severe, even disabling pain. See your doctor if you develop any of the symptoms mentioned above. What can be done for degenerative disc disease? Lifestyle changes, such as weight loss and exercise, can ease your symptoms. Ibuprofen, aspirin, and other over-the-counter pain relievers also can help, as can steroid anesthetic shots. Your doctors have other treatments, including surgery, in their toolbox. What triggers degenerative disc disease? Lots of things up your odds of degenerative disc disease, but older age is the main risk factor. Most people over 60 show some signs of disc degeneration. Back injuries, even minor ones, and activities that put strain on your back can add up over time and contribute to degenerative disc disease. So can obesity. And, finally, if it runs in your family, degenerative disc disease may be in your future. What are the 4 stages of degenerative disc disease? Dysfunction. The discs have begun to degenerate, and you may develop mild to moderate pain. Dehydration. At this stage, your spinal discs begin to dry out. This causes them to lose flexibility and some of their height. Your pain may worsen at this stage and become an everyday experience. Stabilization. Your spine attempts to stabilize itself. This can lead to spinal stenosis and more severe pain. Collapse. As the discs continue to shrink, the bones in your spine rub together and the damaged discs press against nerves. This causes severe pain.